So anti-racism in these times. You will remember that during my whole presidency, I was launching our association, including all of our members and our state affiliates and as many partners as would join us in a national campaign against racism. And that effort is still bearing fruit. So just 1 month ago, as Dr. Ford said, the National Medical Association, which are the black doctors, they have a W. Montague Cobb Health Institute, and in collaboration with the Cobb Institute and the University of Connecticut, they convened a consensus panel on racism and health. And let me tell you, this was the 4th consensus panel that the Cobb Institute had convened. They had done one on HIV/AIDS, they had done one on the pipeline, they had done one on breast cancer, and then they were going to do one that started out being on racism and medicine, right? And through conversation, it became racism and health, creating a canon not just for discourse, but action. Out of this consensus panel, there will be specific recommendations. There's going to be a compilation of, resources. There's going to be a white paper. And so I want to tell you a little bit about that and how that is going to feed into what we had talked about last year as an anti-racism collaborative. So the organizers were from the Cobb Institute, Dr. Randall Morgan, who is the executive director, and Tiffany Reed. Neither of them could be here now because we didn't have any money to bring them here. But Tiffany is an MPH student who basically pulled the whole thing together, So I really wanted to call her name. Then the Connecticut Institute for Clinical and Translational Science, CCATS, funded this whole effort, including Dr. Cato Lorenzen. And then Dr. Helen Wu was my co-chair for this effort because CCATS got money from the Connecticut Black and Puerto Rican caucus of their state legislature. So that's what this money, so you see already it's not just a little thing, right? And because this was Connecticut money, there was a very strong intent to have half of these expert panelists be outsiders that I would sort of invite, and half of them come from the University of Connecticut. And that's such an important thing because, we never know who knows stuff. Like we know our network, but we never know. There's so much talent out there. There's so many people working on these issues. So I hardly knew the names of the Connecticut person. The only one I knew was Wisdom because she used to be at UNC, right? She's now at UConn. But so that's just a lesson. I'm going to tell you the lessons I learned through this whole process. So Dr. Wu was my co-chair, and then Tricia Pitter helped with the business aspects. And then there was me. And even though on the brochure you don't see the American Public Health Association anywhere, because we didn't bring money or anything, but we brought the content, we moved it from racism and medicine to racism and health. And a lot of our members were participating in the thing. So there were 19 consensus panelists. And then the way that we set this up was not just to have people huddle in a room, and it wasn't even just to have people do talks, but we knew that there were people in the community, students, other faculty people from neighboring cities who would be interested in and can contribute to those proceedings. So Dr. Michelle Morse actually was not one of the panelists. Dr. Wisdom Powell and Dr. Linda Ray Murray were on the panel, but Dr. Michelle Morse came from Boston to Framingham, Connecticut to be an observer and contribute lots of stuff. And as I tell you about the keynote addresses, first there was a keynote address this Thursday night, Dr. Rodney Hood, a past president of NMA. So Dr. Randall Morgan, I should have said, was a past president of NMA. We had 5 past presidents of the National Medical Association participating in this. Not because the National Medical Association they've always been interested in issues of race disparities and stuff like that, but they have put racism on the agenda. And so many of them wanted to be part of this because they recognized this was an important effort. Dr. Rodney Hood, however, has always been talking about racism. And he has a very interesting historical thing, and he brings in art and literature and the history and everything. So he did our keynote address on Thursday night. And then the immediate past president, Dr. Richard Allen Williams, on Friday during lunch, provided perspectives on sickle cell disease and racism. Then we had 4 panels on Saturday during the day. The first was sort of historical social context and impacts of racism, understanding the historical and social context. And Dr. Powell moderated that panel, but these were mostly people from UConn and Dr. Hood. Then measuring the impacts of racism on health, developing the methodology. So we had 2 UConn people, and they had me and Dr. Powell, and Linda Berry from UConn was moderating. This is an interesting, except I just want to tell you, you have to sort of know how to get, is it really boring? Or it's okay, yeah. No, because this was like a real thing, right? A real thing. Let me tell you the history of why this is important. You all have heard of unequal treatment? The Institute of Medicine's report. Do you know the history of unequal treatment? The National Medical Association did a consensus panel on racial disparities in healthcare and wrote a white paper and then went to the Congressional Black Caucus of the U.S. Congress, who then got appropriated money to go to the Institute of Medicine to do that report. So one of the possible outcomes of this will maybe go along the same lines, although the Congress is not as conducive right now. But anyway, so we're hoping so that these efforts, by organizing together and coming together in groups and building big agendas, we can have big impact. So the second panel was on methods. The third panel was on clinical, legal, and critical race interventions. Another past president, our immediate past president of NMA, presented on that, plus Tony Iden, JD, MD, MPH, Vernelia Randall, JD, MSN, Dorothy Roberts, JD, and then Dr. Linda Ray Murray, MD, MPH, moderating. So we were bringing people from way outside of the NMA's usual range, and people with a lot of different thinking. And the fourth one was really to bring about community recommendations for the Connecticut Black and Puerto Rican Caucus, for the Congressional Black Caucus, for researchers, as well as anti-racist activists in the general community. So Dr. Berry, Dr. Linda Ray Murray was on that panel. Doris Brown, the current president of NMA, the head of the Urban League in Farmington, Connecticut, or Hartford, probably, Connecticut, and Embrick moderating. So there it is. This was the people it happened last month. We have not pulled together all of the findings yet. Let me tell you how the panels were structured. You say, that's a whole lot of people talking. How did you get any work done? Each panelist was restricted to 5 minutes of their top thoughts. So then after each panelist did 5 minutes of their top thoughts, we had, was it 90 minutes or 45? I don't have it. Well, at least 45 minutes of discussion among our panelists and including observers, students, anybody in the room. So this was not an academic talk at you exercise. We were all listening. We were all on the panels, moderating each other's panels, 19 of us, plus observers, and we did our top thoughts that we thought were important for moving this work forward, and then lots of discussion. So there are a lot of notes to go through to distill this effort. What I'm going to share with you right now is how I introduced this at the beginning of the day on Saturday. So very quickly, though, I'm not going to do my whole 15 minutes I have for the introduction. So I introduced the fact that we at APHA had launched a national campaign against racism with 3 tasks. The first being to name racism, because it's important to talk about race and racial disparities and disproportionality and cultural competence and implicit bias or unconscious bias, and lots of things are important to talk about. But if you don't say the word racism, then you are complicit with the denial, the widespread denial in this country that racism continues to exist and have profound impacts on the health and well-being of the nation. So the first of these 3 tasks of our national campaign against racism was to name racism. The second is to ask the question, how is racism operating here? Which is a legitimate question, because racism is not a cloud or a miasma that you can't get a handle on, but it is a system with identifiable and addressable mechanisms, which are in our structures, policies, practices, norms, and values. We can talk about that later. The third task, after identifying levers for action, is to organize and strategize to act. Because you might say, oh, well, I know what's happening in my city council is how this, that, and the other, and you might even work to fix that. But if you fix that one thing, racism is such a fancy system, it'll just reconfigure and go around you. And so each of us needs to identify 1 or more points of leverage that we can work on where we are, but then we need to be connected with other people. This has to be a sustained and coordinated push to dismantle this system. So when I introduced the thing, I said to people, there is a cliff analogy where I contextualize different levels of health intervention, from health services, ambulance, net, fence along the edge of the cliff, to addressing social determinants of health, moving the population away from the edge of the cliff, to addressing what I describe as the social determinants of equity, which are things that structure a three-dimensional cliff and differentially distribute resources and populations along that three-dimensional cliff. But I did not tell the story because I only had a few minutes, so I gave them the reference. But I said, this is why it's important for the National Medical Association, which is usually about people trying to be the best ambulance drivers they can at the bottom of the cliff, to also be engaged in racism, which is all about the three-dimensionality of the cliff. I then actually told my dual reality restaurant saga story, but I'm not going to tell it now unless we have time at the end and somebody asks me. But if you don't know this story, then you can Google my name, Camara Jones, and TEDx Emory. I did a baby TED, a TEDx Emory, and it's one of the 4 allegories in that TED Talk. But that's about open closed signs. It's about racism as creating a dual reality. Then I defined racism, and this definition that I opened the whole day with was actually formally adopted at the end of the day as the definition of racism that we're going to use for the purpose of this consensus white paper. So when I say the word racism, I'm clear I'm talking about a system, not an individual character flaw, not a personal moral failing, not even a psychiatric illness, but a system of power, and it's a system of doing what? A system of both structuring opportunity and of assigning value. And on what basis is the opportunity structured and on what basis is the value assigned? It's based on the social interpretation of how one looks, which is what we call race in this country. Race is not biology in our genes. And what are the impacts of this system? Well, when we think or talk about racism at all in this country, we understand that it unfairly disadvantages some individuals and communities, but every unfair disadvantage has its reciprocal unfair advantage. So that racism is also unfairly advantaging other individuals and communities. That's the whole issue of unearned white privilege that we hardly ever talk about in this country because it makes some people, especially some white people, very uncomfortable. And we have been valuing white comfort over truth or over justice, but no longer. And there's a third impact, even as we acknowledge the unfair disadvantage or unfair advantage, that racism saps the strength of the whole society through the waste of human resources. I shared with them that there was a Gardner's tale that illustrated 3 levels of racism, and then I introduced what a year ago, when I became president, we launched this national campaign against racism, and there still is an apha.org/racism webpage with some resources. What we had thought was that our anti-racism collaborative with 8 collective action teams would be already up as a social networking thing, perhaps within APHA, even though our APHA Connect is only for members. And so we were going to try to figure out how could community members, pay a little $5 to get access and all. It turns out that APHA does not have the staff right now, nor the funding, nor the proper kind of system, so we will not be hosting this anti-racism collaborative at APHA. So part of what we're going to figure out this afternoon is where to go next, and we actually have some possible solutions represented on this panel. But let me just tell you quickly, before my time is completely up, I'm going to run through the 8 collective action teams that we left last year's meeting with some of the guiding questions for those teams. Then my colleagues are going to talk about their experience at the panel, maybe their top thoughts about it, and then we're going to come back and figure out how are we going to make this real? How are we going to launch an anti-racism collaborative? If not at CDC, if not at APHA, then where? And how? And is it important? And do you agree with the 8 collective action teams? So let me say, the first one, communication and dissemination, the guiding questions for that collective action team would be, how can we support the naming of racism in all public and private spaces, and what tools and strategies are needed to start community conversations on racism? The second one, education and development, has guiding questions. How can we support training around issues of race, racism, and anti-racism at educational institutions of all levels, not just schools of public health or schools of medicine or social work, but K-12 institutions, colleges? And how does effective anti-racism curriculum look? The third one, global matters. How can we use the International Convention on the Elimination of All Forms of Racial Discrimination, ICERD, which is an international anti-racism treaty adopted by the UN General Assembly in 1965, and believe it or not, signed by the U.S. in 1966, and believe it or not, ratified by the U.S. Senate 28 years later in 1994, under which we have treaty obligations today. How can we use that to support anti-racism work in the United States? And what can we learn from anti-racism work in other nations? The fourth team was introduced last year. When we had our meeting, we had 140 people around 8 tables. We introduced this history section. And that's some of the guiding questions. What is the history of successful anti-racism struggle in the United States and around the world? And how can this history guide our anti-racism work today? And how can we institutionalize attention to history itself in all decision-making processes? How can we make sure we all learn our full histories, et cetera, et cetera? The fifth one, liaison and partnership. What anti-racism work is happening right now at the community level? What's happening in other sectors? And how can we create linkages? The sixth one, organizational excellence. How do we answer the question, how is racism operating here? In my school or in my workplace, how do we examine structures, policies, practices, norms, and values, which are the elements of decision-making? Structures are the who, what, when, and where of decision-making, who's at the table, who's not, what's on the agenda, what's not. Policies are the written how of decision-making, practices and norms are the unwritten how of decision-making, and values are the why. And how do we examine that to understand what's happening in our settings? The seventh, policy and legislation. What are current policy and legislative strategies to address and dismantle racism? And then what new strategies should we propose? And finally, science and publications. What research has been done to examine the impacts of racism on the health and well-being of the nation and world? What intervention strategies have been evaluated? And what are our next steps? So I will close here.